So that's what this section is going to be about. So I'm going to briefly talk about this treatment formula I'm talking about. And then the next section, when we talk about business, you're going to see me go and dive a lot more into this. Everything that we do in our clinical practices, we should have focus and we should be able to reproduce that. The reproducibility allows you to sell your practice. It also allows you to have other people on your team and they understand the goal and the results that you're looking for. Remember, people are coming to see us because we're in the age of outcome-based medicine. They're looking for results. We need to give them the results and show them that they are getting results. So the treatment equation you're going to hear extensively about in the next presentations is M divided by T plus S equals R. R is how we quantitate, qualitate, and measure people. And in order to do this, it helps us organize ourselves. So M is the methods or the steps, T is the tools, and S is the skills or the trainings that you take. And so keep this in mind as we go through today. I'm going to show you how that's going to play. And then I'm going to talk a lot more about that, like I said, in the next presentation and all the other stuff on this slide. Here's another way of doing that. The reason I want to point out this is everything we've been talking about so far are tools. We have evaluation tools, which are a bunch of labs that you've heard about. And then we have treatment tools. And sometimes as practitioners, we often get so stuck on selling the tool or using the tool, we forget the larger picture, which is everything else, the methods, the steps, the skills, and how do we show the patient that they're getting results or not. Think of it this way. If you have a contractor who builds your kitchen, they're going to show you the end result of the kitchen, not sell you the hammer. So we want to make sure we're focused on the deliverable, and these are the tools that we use to improve the person's health or deliverables. When we're looking at different deliverables we offer in our clinical practice, the tools that we choose, hopefully you choose tools that hit multiple areas of their disease, whether it be them coming in for acute, chronic disease. And so in this image that I'm showing you, we have ways that we can cure acute disease and cure chronic disease, but we also need tools that help prevent, palliate, and suppress. And the one thing I would add at the very bottom, improved health, is proactive medicine, things that improve overall health overall. So when we're choosing tools, the more dynamic a tool is, it hits multiple areas of these categories. The health strategies we're also going to talk about extensively in the next section. We have two different health strategies. We have the active river of health and the proactive. The river of health is our chronic disease model, and then the proactive is actually our 4 seasons model. So every single person will fall on this river when they come in to see us in chronic disease, or if they have cancer, that's a chronic disease. And most of them, we're going to put them at the bottom of the river, and then we're going to move them up the river. And I'm going to talk about this again extensively in the next section. As the doctor, your role is going to change throughout the river. First, you're going to be what I call the benevolent dictator, telling them what they need to do. And then your role changes as they move up the river to the coach, mentor, and then eventually the trusted advisor. Their symptoms and their condition changes. And what I want you to get out of this slide is that the amount of intervention or the tools that you're using and the steps you're using and the skills that you need are going to change as you move them up the river of health. So in oncology, I came up with this a while ago, and I call it the survive and thrive along the river. You know, basically at the bottom of the river, the patient's coming in, they're holding on to that rock, and our job as clinicians is to stabilize their condition. So we first are working on stabilizing them. As they move up the river, the condition gets less severe and they often have less symptoms. We've done an amazing job of palliating them, and so they don't have symptoms or they don't have progressive disease. At the halfway point, the thing is, if we don't show them some analogy, like this river of health that's behind me right now, and it's also in my office, the patient usually thinks they're done. And you see this with your patients who have oncologic processes. They get it cut out. They see you for a period of time, getting some IVs, and then it goes away. And then they say, I'm done, doctor. However, if we don't educate them early, we know they drifted down the river in the first place. And we want to know, why did they drift down the river? And how can we start to intervene so that it doesn't come back? Because it is guaranteed to come back if we don't figure out the pathology of why they drifted down the river in the first place. So halfway up the river, we're in the restore phase, and then I call it the rejuvenate phase. And then at the very top, this patient is truly thriving, and we're holding them to thrive. So I have my little drawings there. Obviously, stabilizing the patient is foundational support. Everything that you're hearing in this conference is helping you address the foundation. This is the terrain, right? This is the foundation of their terrain. When we get to restore, we're going to fill in little pieces like a puzzle, and then rejuvenating really is recharging their system. So you've already filled in the problems, whether that be biochemical, the epigenetics. You might have re-energized their system. You might have also oxygenized their system, but truly rejuvenating is now where we're making sure that the energy is proper and the pathways are working to their maximal benefit. So if something comes along, it doesn't pound us back down the river. Instead, we get a little ripple in the river. And thrive really is the 4 C's of the health. We are proactively taking steps to engage or improve or enhance health so that each season, when we have an obstacle, it doesn't drop us back down the river. So this would be the stressors that come with the holidays. This would be the seasonal allergies. This would be the activity that you're doing in the summertime. This would be the springtime. This might be weight gain or weight loss. All of these things follow into the proactive health strategy. These are micro details that we're trying to stabilize the person so that they go through each season with the minimal amount of disturbances on their homeostasis, so that the external environment is not influencing greatly the internal environment of the terrain. So a lot of this credit I do want to share with you. I know you've heard a lot about things that we need to do to optimize the terrain. My friend and my mentor, Dixon Tom, old naturopathic physician, dentist, came up with a way to address nature's law. And this is nothing different. If you look at Lindlar's book, Nature Cure, and even if you look before that, back in the late 1800s, we were talking about the reason people get sick is they violate nature's law. They overeat. They're not outside. They're not exercising. Back then, they used to call it gymnastics, right? You could read it back then and say gymnastics, which really meant moving your body or exercise. We're not drinking enough water, or they would say back then, in loveless marriages. So if we violate nature's law, that will have an impact on homeostasis, which is ultimately what health is. Therefore, the terrain starts to fall apart. So every single time I work with a patient, I find, yes, we have all these cool little labs. We have all these techniques. We can address the genetics, the epigenetics, but we must remember that we got to have this patient not violate nature's law. So Dr. Dixon Tom came up with the basic treatment guidelines, and the basic treatment guidelines basically address nature's law. And so this means everybody gets outside, hopefully in the sunshine. If you live up north where I'm at, you take lots of vacations to get to the sunshine. Play, laugh, and have fun. Every single day, find something that makes you joyous in your life. Even when it's the crappiest of the crappiest, find something that makes you have fun. Learn to breathe. 100 deep breaths a day. Some people do the extreme of Wim Hof breathing. I just want people to learn how to breathe. Take a deep breath in, take a deep breath out. Hydration, half your body weight in ounces of filtered water per day. And this is critical for our cells to get the nutrients that they need. Movement, the 10-minute rule. So basically what you've heard from everyone else on this journey, metabolically, you can test a person pretty easily. If you ask them to move their body for 10 minutes, take a break, and then if they can't do it again after 10 minutes, you got a problem. See, if a person can move their body, say continuously, 20, 30 minutes, 40 minutes, because they're pushing through initially, that doesn't necessarily tell us as much as, okay, let's do a movement of 10 minutes. Let's have you rest. Can you do that again? If you can't do that again, we have a problem with your mitochondrial health and aging. Hydrotherapy. So this has to do with dry skin brushing, cold plunges, castor oil packs as well. Grounding. This could be a grounding blanket, grounding pad, or simply walking around in the grass. I've had one patient, I remember Dick Tom talking about one patient also that actually have a sandbox in their home that is grounded, and they can mimic being at the beach because they like being at the beach. That was very grounding for them. Just make sure you don't have a cat in the house. Otherwise, you're going to have problems with that sandbox. Nebulizing. Nebulization is an incredible technique that you can use very dilute amounts of nutrients and deliver it to the capillary beds in a very easy and inexpensive way. So some of these trace minerals or some of these organotherapies, we can actually place in nebulization and nebulize them into the lungs. Sleep hygiene, avoiding blue light, having a very dark room like a cave, and also making sure that the temperature is appropriate for your sleeping. And then we have apple cider vinegar or lemon. And most people think of this as this have to do something with changing the pH, and it really doesn't. It's back to Mendelian's law. Remember back in psychology, they used to talk about how they ring the bell for the dogs, and then the dogs would salivate, knowing that they're ready to eat. So in the current age, what do? We sit in front of a TV, we listen to news, we're stressed out. We run home from work, we immediately eat with our family, and we're stressed out. We don't sit, cook, and enjoy our foods anymore. And so one of the ways that we're trying to reprogram that system to prepare for the meal that's coming is by utilizing something kind of bitter in this sense. So that could be apple cider vinegar, or it could be a little lemon in water before you eat. And then you pick whatever diet works for you. Metabolic flexibility, carnivore, keto, whatever diet that is, of course, low carbohydrate focused, and then specific nutrient therapies. So these were all things that are basic treatment guidelines. Now, I find in my clinical practice, if I give this to the patient, all of these things on the first visit, it's overwhelming. So most of the time what I end up doing is every single visit or couple visits, I drop another one. See, these are curative therapies. I know they're important for them to maintain staying and moving up the river. Everything else that I'm doing and everything that you've heard, we might be working on specific therapies, but I have to still curative therapies. And that's what I'm doing here. Even more important, the at-home strategy, which you'll hear about the 6 stages of flow later. The at-home strategy is when I do recommend one of these, I then have a video that the patient can watch after this, which explains the importance of why they're doing this. My top 5, and I agree with, this is Dr. Dix and Tom also, both of him and I agree with this, top 5 ways to return your patient to homeostasis and maintain good results with the therapies you're using is number 1, something to treat the electrons, something to charge the body up. Number 2 is oxygenation, whether that be hyperbarics, whether that be ozone, something to improve their oxygen status. Number 3, treating the lymphatic system. The lymphatic system is so underutilized. People just ignore this. I see it in the Lyme community. I see it in oncology. They just totally ignore the lymphatic system. But remember, your lymphatic system is where your immune system is, and it's also the garbage dump, right? All the cells that are having normal respiration dump all their material into the lymphatic system. We find that most people, if you don't treat the lymphatic system, it's going to be incredibly hard to get people well. And your therapies just aren't going to work that great. Ibu's going to fail. Ozone's going to fail. They're not going to work very well. It's very interesting. If you look at a systems-wide approach, there is a specialist for every single system but one, and that's the lymphatic system. Why is that? Well, we don't have a drug, and we can't cut on the lymphatic system. It's very simple. You have lots of tools that you can use to address the lymphatic system. I could have a whole lecture on just the lymphatic system. The nervous system. You have to address balancing the nervous system. Most people are purely in a sympathetic dominant, and we have to bridge the gap between parasympathetic and sympathetic, allow people's brain to connect with their bodies. One of my mentors also told me that he lost his father, and he brought up that his father basically said that you were right, I worked on my brain and not my body. Minerals. We're incredibly deficient in minerals, and these are going to get worse. It's because our depleted soil and food supply. So that's the 5th thing that you must address. So I want to walk you through how I might strategize along this river of health. What are the tools that I would be looking at? And this is by far not every single tool that you've learned in this modulation series of the metabolic approach. If a person has poor hydration status, or if they have poor vein status, I'm going to use ozonated saline, and I might use it on the same day that I do high dose vitamin C. This would be appropriate for a person, again, that I can't get their veins, I can't do any of that, they got to have extra hydration. I'm going to ozonate saline, as we talked about in the ozone section. I do use a lot of IV and oral artemisinin or artesunate in a lot of my protocols as well along the bottom part of this river. It's basically a base foundation that myself and Paul Anderson found is essential for a lot of people in a synergistic treatment, not just to help put pressure on killing the cancer, but it's also an immensely strong immune modulator. There's an incredible amount of research on artemisinin in autoimmune disease as well. Mistletoe therapies and or Helleborus. If you learned about those, this is where I put this. And then I also put Ibu as a huge tool here weekly. If you don't have an Ibu, then you can do multi-passes or single passes. Typically, this is a weekly treatment that is being done. We pick one of these and then we do that. At home strategy, I do like the patients to do rectal ozone in between what we're doing in the office. And then if they are having any wounds or poor circulation where I'm concerned with an ulceration or damage, even limb bagging can be helpful for these patients to be done in-house. Ozonated oils and creams, ozonated toothpaste, especially ozonated toothpaste if you're working with anybody who's having any types of radiation or treatments around the head and neck region. We know that that's going to reduce their salivary output and drastically increase their risk of having cavities and cavitations. Ozonated toothpaste is phenomenal if you take the plaque off your teeth and you have a biological dentist. When they put it down and they look at the microorganisms, if you treat a person with ozonated toothpaste and then you repeat that after a couple months, you'll see some drastic changes. So I love ozonated toothpaste. Of course, whatever diet is appropriate, metabolic flexibility diet or keto or carnivore diet, something with a low carbohydrate strategy, and then something with lymphatics. So we do lymphatic dry skin brushing at home. I also use lymphatic herbs like red root. I will use lymphatic tinctures like eye tears by Pekena. I have no affiliation with them, but I like that remedy. Anything I can use to get those lymphatics moving. I'll commonly refer out for Lymph Star. And then in our office, we also have lymphatic compression therapy like flow pressor or just compression therapy. Incredibly important in your stabilized part of the river. Now, for other treatment tools, as we move up the river, eventually you're going to get to a point where you're going to decrease the frequency of giving things. I think it is incredibly important for mistletoe and or Helleborus to be used still with this patient. If you are reducing the frequency of that, I think this would be going down to a quarterly dosage strategy instead of every single day, in this instance, halfway up the river. Ibu is now going to be either quarterly done, so every quarter I'm giving them an Ibu to do. Multi-passes, this may be done weekly to monthly. Remember, this isn't quite as strong as an Ibu. If you do have these things, though, that definitely we can use those either weekly to more once a month or twice a month in a maintenance strategy. Still having them do rectal ozone, still having them use those creams. And in this instance, if I haven't already, I'm going to use something called lipoic acid mineral complex. I believe that this is a phenomenal supplementation to improve mitochondrial health and upregulate complex 1 through complex 4. There's not a lot of other things I've found out there that can do that as effectively as this multiple polymer mixture. Once they get to optimize, this is also very similar. However, I'm still doing quarterly Ibu. I'm passionate about doing quarterly Ibu just for proactive medicine, just because I know how many benefits it has, as you remember me talking about, for oxygenation, for filtration. It's on my maintenance list of quarterly to do. Mistletoe or Helleborus may be now done twice a year as an immune tune-up. Rectal ozone may drop to 3 days a week, and then we're still using ozone creams, toothpaste, metabolic flexibility. And really, 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 this is important. If you have not already, bring on that electron therapy, which has to do with PEMF, pulsed electromagnetic frequency, or some type of grounding therapy. Excuse me. And then anything above this, again, 3/4 of the way, this is really energizing. And then up at the top is where we're doing the thrive. That's the 4 seasons approach. Now, I want to remind you of this because most of the time we're focusing in on the lesional aspect, the physical presentation. And it's such a small part of the picture. Again, when a person comes in, this isn't cancer that we're focusing on. This is a person that happens to have cancer, and likely they're going to have other things. The reason they got there is not just all physical. Most of the reason they got there is actually energetic. And the thing that probably will blow your mind, and you might have heard it earlier in the lecture, a lot of the reason that they're going to get this disease process, it started preconception. It started before they were even born. That's the reason they got to this point. And we can pick up on key cues now that we've, gotten them out of I'm in a really bad spot. The cancer's progressing. I need to get this stable. Once we get them up on the top of the river more, that top part, that 3/4 of the top, we really, really, really must focus on this energetic level. And you'll get a pretty good idea of how to treat this based on the history of how they presented with their diseases. Let me give you an example of what that might be. And then I'll show you some treatments. So most commonly, what we'll see is women will have a psychotic miasm as part of their terrain. This doesn't mean psychosis. We'll get that out. It has nothing to do with a psychological illness. Psychotic miasms typically present with holding on to things, walling things off. So let me give you an example of a typical presentation you see. when I ask a patient, okay, tell me about your childhood. What kind of diseases did you get? They will tell me that either they got a lot of strep throat, they got a lot of sinus infections, or they got a lot of ear infections. Okay. And then what happened? What happened when you hit puberty? Well, then I had puberty hit. My menses were really rough. They were very painful, very crampy. And then what happened? I was put on birth control. And then what happened? Well, then I got an ovarian cyst or a fibroid. And then what happened? Well, they removed the fibroid. And then what happened? Well, then I got breast cysts. And then what happened? Well, then I got either breast cancer or they get uterine cancer. It is so predictable if you look at their past and how their diseases present, that you kind of understand how they're going to present and how they're energetically, how they're going to push things out physically. This is different than a person who eliminates, say, from a psoric miasm, which they push everything out to the skin. They're incredible eliminators, right? They typically get things like ulcerative colitis, or they'll get eczema. If you treat that by suppressing that thing, it dives deeper. So eczema, if you treat eczema with a steroid cream, they'll get asthma. Or even worse, they'll get some type of like IBD or ulcerations of the colon. So think about it from an energetic standpoint, from preconception care. Now that you're up at this top 3/4 of the river, how am I going to address that? You can't address that with IV nutrition. You can't address that with biochemistry. And I love biochemistry. You can't address that with manipulation, any of that. So you have to figure out something else. And if you don't do this, you have to refer them out. So I like, my favorite is flower remedies, flower essences like Bach flower remedies. I also like craniosacral therapeutic touch, but there's a whole bunch of things up here. So some people will use essential oils. Some people use chakra therapy. One of the things I learned from Dr. Dixon Tom was chakra therapies. He'll have people wear red underwear to stimulate the base chakra from color therapies. I think that's brilliant, right? It's a very low intervention therapy, and using color therapies to stimulate the chakras. Also music therapy. So what I'm telling you is, notice how large this top level is. This is ultimately going to be the most important thing that you do with a patient when you get them up from that 3/4 to the top half part of the river, that you have to address. And if you don't, you need to find somebody that will address this. So my 8-visit strategy, this may or may not be helpful for you. I hope it is. Somebody asked me to write this down because it kind of separates how I present with a patient versus some of the other generalists out there, generalist physicians. Goals of the first visit. What am I doing? Pretty much I'm educating them to get a second visit. I want to show them I have a plan and I have a formula to get them from point A to point B. I'm going to assess them. This is all the labs that you've learned about, all the evaluation tools that you may have in your office. I'm going to take assessment, and then I'm going to be extremely taking charge and be aggressive with my treatment. My goal is to hit them as hard as I can to palliate the symptoms or to get some leverage so they feel something right away. If I haven't done that, I have failed capturing their attention. That may be taking their pain level down. That may be adjusting them in the visit, some type of touch therapy. I need to do something to get a significant movement in the first visit to basically build some. It helps strengthen the relationship that I have with that patient and the trust that we have between each other, that I know what I'm doing. Goals of the second visit. This is basically to review everything that we worked up the first visit, also show that we have a dedicated plan based on the findings of the assessment. We're still taking charge and we're basically hitting it as hard as we can. Visits 3 through 8. Now I kind of clumped these together because in essence here, your job is, it's a game. It's literally, how do I hold the patient so they don't go somewhere else? they get off track, they get bored with the treatment that you're giving them. And in order to do that, you have to be incredibly good at motivating, inspiring, and engaging or empowering the patient. This is still palliating and treating the symptoms during most of these visits. The curative treatments you start to layer on over time in small amounts. When they get up to about the halfway point on the river, that is then when we need to really start changing our game and focusing on energetic or functional therapies versus physical therapies alone. Goals of the 8th visit on. Again, continuing to motivate, inspire. My role as a physician has changed. I'm not the benevolent dictator. I'm focusing on, are you following your nature cures? Are you doing these things daily? And if I'm also focused heavily now on either addressing or referring out for those functional and energetic therapies that I just talked about. So a little bit more detail on my treatment equation. Step 1 is stabilize. This can take 3 to 12 months. One of the frustrating things I think I had and a lot of practitioners have is once they get out of clinic rotation, they never get to see what it actually takes to address chronic disease, how long this takes to address. And to stabilize a patient, depending on their condition they have, I will tell you, for those new docs that are on here or you haven't figured it out yet, it takes between 3 and 12 months to get this addressed. Step 2 is 1 to 3 years. And step 3 is usually 3 to 10 years. And then the proactive strategy really happens about 3 years plus. Now, why step 3, 3 to 10, and why 3 to 3 plus for Thrive? Some people are never going to make it to step 4. They are not going to thrive. They are not interested in getting to this level of health, and that's fine. So they may only be in the rejuvenate section, and that may be 3 years before they're ready to go to Thrive. That may be 5 years before they're ready to go to Thrive. That may be 10 years before they're ready to go to Thrive. My job as a clinician is to hold them so that they don't drift back down the river. And so what I'm doing is it's treatment and monitoring, holding them in a holding pattern. And so everything that I am trying to tell you and try to do, you could be the smartest person in the world from a biochemical science degree to assessing your patient with different labs or treatments. However, a lot of this has to go down to bedside manner and strategy and understanding the language of what's going on with the patient. If they're in your office and they start saying things, if their eyes start drifting like that, understanding and recognizing how to pivot and communicate effectively to get their attention. I remember a long time ago, somebody always told me to go study Dale Carnegie and some of his methods. If this is a weakness, you really, really need to understand and learn how to communicate effectively with patients and understand how their body language is reflecting so that you can pivot and intuitively feel what is wrong with them. If you listen and you open up your heart, intuition will come in, and trust that intuition. It will tell you a lot about what needs to be done with that patient. So what are we doing during Stabilize? Stabilize is evaluation labs. As you've heard extensively earlier about different labs, I do like live blood analysis. I know it has its problems, but I use it because it's a great measurable. It gets the attention of the patient to do something. I also, you heard extensively about different companies that do blood biopsies. I think that is important in this step, this early step. I think nutrient evaluation, understanding their mineral analysis. I do find hair is helpful here. It has a lot of quirks and problems. Of course, you can't rely on it for heavy metals. And you might get falsely elevated numbers if somebody's applying something topically. So you have to use it with a grain of salt, but it's cheap. And it's also one of the few ways that I can test a person quickly, affordably to see how much of their minerals are actually getting into a tissue without biopsying that tissue. The only other way we can do this is doing cell analysis like white blood cell or red blood cell. And even though it has its benefits too, it doesn't tell you what's getting put into other parts of the connective tissue. Toxicity evaluation is absolutely critical here. You've heard a bunch of other labs. And then treatments are focused around, again, routine and nature's law. I like habit-based lifestyle. The more habits you have, the less your adrenals are getting stressed. So meaning you wake up at the same time, you go to bed at the same time, you eat dinner, you eat breakfast, if you eat breakfast, if you're not fasting. You brush your teeth, you do everything as consistently as possible for routine. We're also focusing on depuration and detoxification. We're grounding. We are using our oxidative treatments, whether that be ozone, vitamin C, hyperbarics. Minerals are important here, movement, and some type of connection to a higher power or people. The patients who do not have support from their family or support from a community are going to have a much more difficult time making it through this. The patients who do not have a connection with something, and I'm not saying it has to be a specific religion, just something, are going to keep pushing and are going to live a lot longer and often beat this thing versus the ones that are hopeless and don't have any connection. They have to find that. It could be simply a connection with nature is all they need. My results in this step is really improvement of quality of life, improvement of energy, a sense of purpose, because a lot of these patients, they've gotten to this disease state because they've lost that sense of purpose. Have you ever seen how many people, what happens to them when they retire? They push. That is what defines them. And then they retire and they either die of a heart attack or they get an aggressive cancer diagnosis. It's pretty classic how that happens. And it's because that was what defined them. And now they don't have a sense of purpose. So this piece has been kind of thrown out the door. Sustained energy, protection of the nerve, brain, and gut, as those are the tissues that are going to often take the most severe hits during conventional treatments. Step 2 is restore. I do find some analysis like contact regulation thermography helpful to show you, are you missing anything of stagnation or infection that might be going on, like in the teeth or the sinuses, for example. This is also where you still want to be monitoring with your blood biopsies. You want to be looking at your tissue and your other comprehensive labs. And if you have not already, you do want to be working on that mitochondrial function and figuring out, why did it get so toxic in the first place? Or are there genetic SNPs that are blocking the mitochondria from working effectively that you can address? So then you can see kind of my treatment tools here. Added a couple things, couple new things on here. Cell health therapy. Cell health therapy is IV nutrition or nutrient therapy. Also, I think allografts, which are basically biologic material, do have a place to stimulate tissues. They're not stem cells. Don't call them that. I have a whole nother lecture on that. When you mention stem cells, people always think they're going to divide into a tissue. Nothing out on the market does that. It simply has a paracrine effect, just like every other therapy where it's stimulating other cells to turn on. Immune therapies like thymosin or mistletoe therapies are also incredibly important in the restore phase. Rejuvenate phase, we're still doing a lot of screening labs. See, during this time frame, as many of you know, breast cancer patients are usually the ones that I find will surprise you the most, where you can get 3 years out, 5 years out, even 10 years out, and they still have one of the higher risks of having a recurrence. And if you're not paying attention to this, it usually reoccurs, unfortunately, in the lungs, in the spine, or in the brain is what I see. And that's sometimes like 10 years, or you'll see 12 years, because they never addressed the reason they drifted down the river in the first place, and they just thought it was done. They were told it was done. So some type of brain work has to be done here, especially with your patients who have gone through this traumatic event. Some type of trauma therapy, whether that be EMDR or something else, needs to be done here. Brain charging needs to be done here too, because they've been through treatment and their brain just isn't working as well. So this may be something like NeuroTracker, DHA, essential oils, bovine brain. And we can assess that with a program called Brain Gauge. I'll show you one, and I'll show you a case a little later of what I mean by that. Thrive literally is, what can we do to maximize the mitochondria, improve the lymphatics, charge the system, oxygenate the system, keep routine, and not violate nature's law as much as possible. That is the ultimate goal to preventing us from dropping back down the river and being proactive with our health. So that last step really is the proactive 4 seasons inner shield strategy. I designed this logo about a year ago because I think anywhere in your health journey, even if you're coming in looking to improve your overall health as you're aging, we have to be shielding ourselves and strategizing quarterly or seasonally. How do we continue to address health? In the healthcare model, unfortunately, we wait until things are broken. We can't do that because we see how incredibly expensive that is. Patients that are proactive with their health end up doing much better when a disease comes along, or they never get the disease in the first place. And more importantly, they age more gracefully instead of aging in having a chronic disease that cripples them for the last 5 years of their life or more. So an example of Thrive in the fall, a lot of this is immune fortification. Winter, a lot of this is immune and energy fortification. There may also be things that we need to do in the pain sector, depending on the cold weather or what activities they like to do, if they like to ski. And this may be using perineural injection, PIT, or NOT therapy. This is neural ozone therapy, PRP, or ozone therapeutic injections into the joint structures. In the spring, we're trying to recharge the system. We're trying to also keep the immune system in hormesis because we know that allergies are more common here. And when we get that extra histamine kick, we kind of throw the person awry as well. Summer is about hydrating and building. We have to keep ourselves hydrated. We're very active. It's very hot out. The other thing is we're trying to build our health levels because this is a very charging time of the year, because we know we're entering the next few seasons, which is going to be more hibernation or atrophies of the tissues versus this building up. Most people, the poorest prognosis or the poorest efficacy rates of survival or actually rebounding from a debilitating condition is going to happen in the summer, not in the fall and winter. So let's talk about ozone a little bit more. I know we did a whole section on that, but more oncology specific. So why would I use this tool in every single stage? Well, here's a paper talking about ozone being very, very helpful for patients with fatigue as a side effect during treatment. So our preliminary data demonstrate ozone therapy is valid supportive therapy for fatigue in cancer patients, both during cancer therapy and in palliative settings with no significant side effects. Again, this brings to home, whether you're doing EBU, single pass, rectal ozone, an absolutely dynamite tool to improve your patient's quality of life. And then when you move them up the river, a dynamite tool to improve oxygenation and tune up your redox systems, antioxidants, and improve your immune modulation between your Th1 and Th2. Ozone is a preconditioning agent. So your patients who are actively going through cisplatin therapy, this is done in nephrotoxicity, specifically pertaining, this treatment was done in a rat study, but rats are similar enough to us, we can extrapolate this out. So there is a dose-specific finding here. Notice that we get up glutathione levels increase as we add ozone, but then when we reach a certain threshold of dosage, it starts to decrease. We're overwhelming the system's ability to upregulate glutathione production. So this is my argument that I showed you in both the ozone section and the EBU section, that lower dosages of ozone are safer for the patient and improve health versus blasting them with a very large, high oxidative stress level. They already have this. That's the reason they're going to have problems. So we want to start with a very, very low oxidative stress to train the system like you're training your muscles in the gym. We also know that ozone is helpful with tumor hypoxia. Tumor hypoxia causes decreased apoptotic potentials in treatments, which can therefore lead for your resistance that you see in radiotherapy and chemotherapy. Tumor hypoxia also increases the need for angiogenesis. So another reason we want to use ozone as one of our key tools in our treatment formulations. Preconditioning for lung injury. Now, we're never, ever, ever going to breathe ozone into the lungs. The lungs have the weakest redox system, antioxidants specifically. So the treatment that's done here, again, a rat study, is specifically doing something like MAH, major immunotherapy, or rectal ozone, or EBU, to improve the antioxidant production that would be found in the lungs. Again, training the system, just like you go to the gym to train your muscles to get stronger and more coordinated. We're using a little bit of ozone to train the system to increase, to be more efficient. Radiation-induced rectal bleeding in prostate cancer patients. So any of your patients who are going through prostate-specific radiation therapies, absolutely, this is a shoe-in for people to do rectal ozone. Rectal ozone will prevent or help manage patients with prostate cancer who have rectal bleeding. How would we do that? I'll remind you again, basically the insufflation is between 150 to 300 mils. Most commonly, we start with 20 micrograms per mil, and the treatment is done at least 3 times a week. Again, at the lower part of the river, remember I showed you even 5 times a week. Topical ozonated oils showed no impact due to the oil not being able to absorb into the mucosa. So it may be okay on the external portions or for ulcerations, but it doesn't seem that ozonated oils have an impact on rectal bleeding in this specific paper. And clinically, what I've seen as well, you do need to use rectal gas visit. What am I doing? Pretty much I'm educating them to get a second by that, entering the next few. So this is my antioxidant production that would be found in the lungs. Again, training the system, just like you go to the gym to train your muscles to get stronger and more coordinated. We're using a little bit of ozone to train the system to increase, to be more efficient. Radiation-induced rectal bleeding in prostate cancer patients. So any of your patients who are going through prostate-specific radiation therapies, absolutely this is a shoe-in for people to do rectal ozone. Rectal ozone will prevent or help manage patients with prostate cancer who have rectal bleeding. How would we do that? I'll remind you again, basically the insufflation is between 150 to 300 mils. Most commonly, we start with 20 micrograms per mil, and the treatment is done at least 3 times a week. Again, at the lower part of the river, remember I showed you even 5 times a week. Topical ozonated oils showed no impact due to the oil not being able to absorb into the mucosa. So it may be okay on the external portions or for ulcerations, but it doesn't seem that ozonated oils have an impact on rectal bleeding in this specific paper. And clinically, what I've seen as well, you do need to use rectal gas ozone. So this is the conclusions. All right, so hopefully that helps round your brain out of how do I approach all these tools, how do I put them in a formulation. The business section, we're going to hit that treatment formula and that those strategies of active and proactive a lot harder, but I just wanted to introduce that here. So let's talk about some brief cases now that this is kind of the summary of all the tools. So this is a prostate cancer patient, 69-year-old prostate cancer, 69-year-old with prostate cancer, stage 4 prostate cancer diagnosed in 2015, age 65, metastatic bone disease, presented us really after conventional therapy failed. So they did pretty much suppressive surgery, androgen deprivation therapy, and then we're on to other things. No pain was reported at the time for this patient. So some of the tools that we used 80 milligrams, which now I would go higher, of melatonin. We actually did put him on a low carb, heavy dense protein or heavy dense plant-based diet. So low carb, got all the junk, all the grains, heavy amounts of plant-based, cruciferous, vegetable focused type diet strategy. We used DIM. We used EGCG. We also used curcumin, liposomal artemisinin. We used fish oil, modified citrus pectin, low-dose naltrexone, and we used IV vitamin C, ART, and DMSO alternated with ozonated saline twice a week. So he would get vitamin C infusions plus ozonated saline twice a week. The main reason for the DMSO is DMSO has an extremely beneficial property of both for pain and inflammation, but it also is a driver to get things into like the bone tissues. So he was stable until 2022. He had some progression then into the lungs. We added mistletoe at the time, both IV and subcutaneous. We had quality of life improved. Unfortunately, this patient passed, but he was very comfortable in his passing in July 2022. And just like Naisha has been talking about, unfortunately, the patients who have had androgen deprivation therapy and have come to us late stage, they're incredibly challenging and difficult to treat or stabilize versus a patient who has not. In this category, we're throwing everything we got at them to buy time and provide improved quality of life. Vaginal cancer, 96-year-old currently. She was diagnosed with vaginal cancer at 94. She initially thought it was a yeast infection, presenting mainly for pain relief. She was offered radiation therapy, but given her age and location, obviously you can imagine this is not going to help her quality of life. She's 96 years old, right? We have to really think about what makes sense here, because she's at the time in her age that the cancer probably not going to take her. She's going to have something else happen to her. PET scan shows possible growing nodes, pain, the most significant issue. Her trifecta labs were nice and low at the time that we did run them as well. We put her on a metabolic flexibility diet, liposomal artemisinin. I tend to like either Quicksilver if they can gag it down, or there's another one called Doctor Inspired, which is in a capsule form of artemisinin. Remember, oral artemisinin, you do want to pulse it. So it's something that you pulse 3 days on and then 4 days off. So typically I would do one capsule 3 times a day, 3 days on, and then 4 days off, or one teaspoon or 3 times a day if you're using the liquid for 3 days on and then 4 days off. We did IVC and artemisinin. Well, at least it was proposed, but this is a person that lived about 2.5, 3 hours away, and being 96, obviously this is a little challenging to get. Vitamin A, reishi ganoderma. We also used arnica and arsenticum homeopathics for the pain. Viscum M, low-dose naltrexone. She was not on opiate therapy yet. We were trying to avoid that as much as possible. We also did compound A pain cream with deoxy-D-glucose, gabapentin, ketoprofen, amitriptyline, and tetracaine. We did vaginal ozone at 40 micrograms per mil, 4 to 5 days a week. And we did vaginal ozonated suppository 6 days a week, where she put one in the evening before bed, wear a panty liner, and then go to bed with that. Significant improvement initially in her pain levels. Some burning was still present when she'd urinate. So she still was having that pain that we couldn't get gone. She's still refusing radiation therapy. I don't blame her. I tried to talk her. I said, if you're going to go that route, at least strongly consider doing hyperthermia treatments instead, or with. She'd been stable without any problems for at least the year. And her trifecta labs looked great for the year. So again, as we've been talking about earlier, yeah, she's got this cancer. She got some PET positive stuff possible, but nothing progressing. And then she's got a stabilization of her trifecta labs. Then she got COVID in early 2022. And literally what that did is it kind of kicked everything up. She did make it out of the hospital. It was extremely difficult. She did make it out. September 2022, we did PIT therapy to try to combat the pain. The thing that you probably noticed with COVID is not just with coagulation disease, but it drastically caused increase in neuroinflammation. So the cream wasn't working as well as, and all the things we were doing wasn't working as well as what it was previously. September 2022, we did perineural injection therapy, not into the vagina, but into the nerves that innervate the vagina. And I've used this in quite a few people. I used this on a stage 4 lung cancer patient, or bladder cancer, that went to the lungs and was progressing in the lungs and causing severe amounts of pain that opiates and fentanyl didn't touch at all. And we were doing PIT injection therapy daily around that. And that was able to at least give her each day, it would drop the level down about 50% to down to like a 50% or 40%, where her pain level was like 12 out of 10. So 5 or 6. So that's significant, right? We did have to do it daily back then to provide relief, because it would wear off, because this big tumor is basically pushing on all those nerves. So this is another instance with perineural injection therapy. We did treat the nerves, the innervating nerves, the peripheral nerves, and got a 70% improvement in her overall pain level. Now, pain levels did come back again. Usually she would get 3 to 4 weeks, and then I'd have to tune her up. Now, unfortunately, like I said, she's 96. She did end up passing at 98 years old. Not from the cancer, though. It was basically because she ended up having a stroke. So, like we've been talking about earlier, very glad we didn't do radiation therapy on her. Her condition was stable enough. She had a stroke that was related to a vascular issue, not to a coagulation issue from the cancer that took her. Okay. Breast cancer patient. So 66-year-old patient with breast cancer, initially presented with stage 2, grade 2, ER positive, HER2 positive, infiltrating ductal carcinoma. Was doing treatment with Herceptin and aromatase inhibitors, was unable to tolerate the aromatase inhibitors. They tried multiple different forms, multiple different dosages. It didn't work. Blood pressure would shoot up, headaches, all kinds of bad things were happening. We put her on a metabolic flexibility diet, similar to what you've heard. We did liposomal ART. We did IVs twice a week. Basically, she had disease resolution after 1 year at 67 years old. We continue to track her lab. She's one of my most compliant patients. And there was, this is a little older, but there's no evidence of disease. And she's currently about 74, 75 years old. Biggest thing we're working on right now is we recently discovered quite a bit of mold in her home, which may have been one of the reasonings for what led to this. So we're now kind of in that halfway point to 3/4 point of the river of health with her, where we're trying to dig and find other issues that led her to her diagnosis. We did track her cognitive score with something called brain gauge. Again, I did put on there the incredible amounts of mold. So we were doing nutritional therapy with NAD, basically 100 milligrams of NAD, glutathione, poly-MBA, and we alternated this with IV nutrition plus Plaquex, which is phosphatidylcholine, which is extremely important in the cell membranes, brain health, but also kicking out the mold toxins from the cell membranes. We do ozone MAH once a month, and then we also do Plaquex, probably a little more common than once a month now that we found the mold problem. We were doing once a month with her for just her brain, but obviously more to that. We also do an adrenal endocrine reset with ozone. It's subcutaneous ozone injections about every other week along her dermatome. And basically what it's doing is it's causing a reflex response back to her adrenals, just like when you get an adjustment. But I find this procedure is a lot more powerful for triggering the adrenals to modulate. So this is that brain gauge I showed you. And this is the course of almost over a year of using IV nutrition, neurotracker training programs, just to kind of show where she ended up starting, which it was rated at a 58, is what I wrote down for you. And then over the year that we tracked her into the August, we noticed that she jumped up to a 78 overall. Still had a lot of room to work. You can see her speed is only 31 out of 100. And then she has some focus issues, but this is an example of an amazing measurable, and I can track this over time. There are, like any tool, there was an outlier on here. You see the 92. She either had an amazing day that day, or like I said, most of the time you see it's an outlier. We just had to throw that out. Hodgkin's, patient with Hodgkin's lymphoma. This is a 21-year-old with Hodgkin's lymphoma. Stage 2, initially presented for only natural therapies. Diagnosed in 2019, was working with a health coach who was really only addressing like this, right? Just EBV. And we ended up actually working her up and finding out she really didn't have any EBV reactivation at all. She was just being treated thinking that the EBV must be the cause of her Hodgkin's lymphoma. So we were doing nutrient infusions and mistletoe therapies. Specifically, we did IV nutrition with vitamin C, and we were doing mistletoe on other days. So we were alternating. As you'll learn probably in a different lecture, that we don't do vitamin C and mistletoe on the same day. We're also doing ozone to charge her endocrine system. So those adrenal shots that I was talking about. Some other things that we added to our protocol, poly-MVA, ozonated saline was here as well. Worsening of her disease, and basically she only wanted to treat this naturally, and unfortunately it did keep progressing on. So I was able to convince her to do some chemotherapy while we would continue to do what we're doing. She failed the first line therapies of their chemo. Second line therapies worked, and she was able to do her stem cell transplant. Her recovery and her ability to go through these therapies was incredible, though, meaning it surprised everyone in her oncology unit. I'll tell you that when she went back for a checkup, after, she did her stem cell transplant, they said, whoa, this is impressive. We usually don't see people rebound this quickly. And they were kind of caught off guard of what to do with her, because usually, let's follow up again and do some more things. But they said, you're in a situation that we don't usually see people at unless it's like 4 to 6 months out. So incredible rebounding. She still does mistletoe therapies. She also does nutrient infusion therapies. We have backed them down, though, since her initial diagnosis. The main thing was kind of cleaning her up and revitalizing and recharging her post-chemotherapy. As we know, the chemo put her into a menopausal state. So she's currently been in remission now for, at the time I wrote this, I would say now this is up to about almost 12 months. No signs of disease. And yeah, I would say, it's up to 1.5 years post-diagnosis, so a little bit longer. We continue to track her. So I hope that kind of gives you a little bit more context of a way to get your brain wrapped around things, of using analogies, treatment formulas. We're going to go into them a little bit more in the business section of how I look at and approach a patient. Again, like you've been hearing earlier, you really, really, really need to use your labs and your analysis to get an idea of what therapies are going to work and what you maximize, because otherwise it's just too overwhelming for people. And you have to keep your radar open here. Don't get so focused in here. If you don't do all these other things like mold or Lyme or all these other things, that's great. Find your partners that you work with. But a lot of people, I will tell you, they get their blinders on right here and they just focus on the diet, or they just focus on the infection like you saw with the EBV, and they're often missing everything out here. So I want to make sure you don't do that. You want to write out your treatment formulas, pick your tools that resonate with you and put them in the river of health. So with that said, thank you very much for listening. And I will see you soon in the business section.